Hello everyone and welcome to session 8. Today we will discuss the burden of non-communicable diseases on refugees and the key challenges to manage them in the humanitarian context. Our objectives for this session will be to identify key challenges of managing NCDs and palliative care, and to assess and evaluate strategies that measure the success of chronic diseases programs among refugees in a humanitarian crisis, in addition to learn about incidence, prevalence, and mortality rate of NCDs for refugees. Well, just imagine if we, during an emergency, only addressed prevention of injuries and treating infectious diseases. What would happen to people with ischemic stroke survival that are taking coagulants, or patients with diabetes that are controlled by insulin? Or what would happen with children with blood disorders, or patients that are under hemodialysis for the kidney failure? Infectious diseases continue to be an urgent concern, and health practices in humanitarian situations developed by camp setting remain important. Most of the world's refugees today primarily reside in non-camp, urban settings, and their health needs have increasingly shifted to cancer, diabetes, and other non-communicable diseases. Here are some general key facts related to chronic diseases. NCDs kill more than 40 million a year, which is almost 70% of all deaths globally. 15 million of them are in the age between 30 and 70 years. 85% of these premature deaths occur in low and middle income countries. The major four killers of NCDs are cardiovascular diseases, cancers, respiratory diseases, and diabetes. The behavioral risk factors, including tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets, all increase the risk of dying from NCDs. There is a need to improve detection, screening, and treatment of NCDs, as well as the more ignorant one, which is the palliative care. Non-communicable diseases also account for a significant share of the health burden in different countries facing crises, including Syria, Afghanistan, Eritrea, and Sudan. Countries that are similarly major source of refugees. In Myanmar, for example, which is the source of over 1 million Rohingya refugees, cancer, heart disease, and other NCDs now represent more than 60% of the country's health problem. Cardiovascular disease, diabetes, cancers, and chronic lung diseases were the leading cause of death in Syria prior to the war, and recent facility-based and community-based surveys confirm a significant prevalence of NCDs among Syrian refugees. In 2014, a review by UNHCR found the primary reasons for Syrian refugees to seek health care were diabetes, cardiovascular diseases, and chronic lung diseases. But why NCDs management should be considered a priority in complex emergencies? There are many factors responsible for the increase of NCD's prevalence and burden in this context. In addition to the progression of existing NCDs, these conditions are also important. Overcrowding and inadequate sanitation, poor shelter, food and water shortage, and disruption to healthcare services all lead to increased incidence of NCDs in the context of refugees. What else? Host nations are required to provide care for the NCDs of refugees for many years. Most refugees worldwide are now in protracted situation, which UNHCR defines as those in which 25,000 or more refugees of the same nationality have been in exile for 5 consecutive years or more in a given host country. Governments, humanitarian organizations, and international institutions should invest more in preventive and primary care. Any improvement in refugee health will require increased attention and access to lower-cost approaches to support the prevention and management of chronic diseases in a large population of displaced individuals. Host governments and the humanitarian organizations should increase health promotion efforts and create more comprehensible health referral mechanisms. In order for individuals to effectively navigate a health system and seek out care for their conditions, they need adequate awareness of the symptoms they are experiencing and the means to seek health care. Host governments and international organizations should develop a new framework, a new health response framework that accounts for today's protracted urban refugee crises. Ignoring the challenges presented by NCDs will only defer and increase the human and economic costs for refugees and host countries. The urgency of providing sustainable health care to displaced population with chronic illnesses highlights the immense gaps and unmet needs in host countries' health systems. Addressing this challenge will require both the development of a more representative humanitarian system and modification in healthcare delivery in host countries. Thank you and wish you